Continuing here on a special edition of the Exam Room Podcast brought to you by the Physicians Committee with the weight loss champion Chuck Carroll. Telemed. It's such a new concept for so many of us. It doesn't matter if you're 15 years old or you're 85 years old. There's a pretty good chance that you haven't yet used it. And it just so happens that it's available at the Barnard Medical Center, and now with everybody holed up in their homes and a lot of doctors not having their offices open, a lot of them are doing telemed. So it's a great time to introduce you to that concept. And for that, we welcome to the show Dr. Vanita Rahman. Welcome back to the show.
Thanks, Chuck.
How are you and your family doing?
We're doing really well. It's been a relatively seamless transition. My husband and I are able to work. I'm able to see patients because of telehealth. I think it's probably been hardest for the kids. I think they miss the school, they miss the structure, they miss their friends.
The kids miss school? Wow.
They actually do.
You may have the best kids in the entire world. I'd be celebrating right about now.
And they're good kids. I can't complain.
Okay. Well, I think that, a lot of people are rightfully concerned about the coronavirus. It's going around here in the D.C., Maryland, Virginia area. We have been ordered to stay at home, not even allowed out unless it's for an essential purpose. And I think that that's really the vast majority of states. So if you can't go out, let's bring the doctor's office to you. Telemedicine. Can you just kind of walk us through this process? How does it work? How similar is it to a regular patient visit?
Yeah, so, it's actually amazing technology. And we were doing this at Barnard Medical even before the COVID-19 outbreak. So we are pretty comfortable doing it. But remember the days of the house calls where the doctors would go to the patient's home, they would examine them, talk to them, prescribe medication, order labs, whatever. It's actually very similar to that, but we don't need to step into someone's home. We can do it sitting in our office or in our home, and we can see our patients remotely. And it's a great marvel of technology. It's wonderful.
So you mentioned technology. What does the person need? Just a computer or a smartphone?
Yeah, so they need two things. They need access to the internet, so they can either access through their smartphone, they can access through their laptop or tablet, and then they would use the app for the telehealth platform, log in, and it's as simple as that. And then there will be a button saying, I'm ready, and then the doctor will push their button on their end and say, let's start the appointment. And it's literally that simple.
So you and I are talking via Skype right now. I would imagine this app that is used, it's very similar, right?
Exactly, yeah. So we use a platform called Chiron that we use, and it's very similar. It's really no different than what you and I are doing right now. We are looking at each other, and it's almost like I'm sitting across from you speaking with you, Chuck. And that's what the patient experience is like too, is I feel like I'm sitting across from my patients and speaking to them, and I can see them, they can see me, and we can talk about whatever is going on with their health.
What about the elderly patients who may not have the smartphone, may not have a laptop or a computer in their home? Believe it or not, there are people out there that they're not up to date on the technology. Is it possible just to do a phone visit?
Absolutely. And that's one of the great things right now is how flexible insurance carriers are being. For example, DC Medicaid will now cover telephone-only visits, which is great. So some of our patients don't have access to a laptop or a smartphone, or they may not feel comfortable using it, and then we will just call them. We will schedule the appointment like we normally would and get their phone number, and I will call them when it's appointment time, and we'll go through, whatever concerns they have and how I can help them.
I'm glad that you brought up the DC Medicaid. I was wondering, insurance, it works identical with telemed as it does with an in-office visit?
Yeah, even before the outbreak started, a lot of insurance carriers were seeing the benefit in telehealth and seeing that remote visits are actually more desirable. In some cases, they're safer. For example, if someone has the flu, we don't necessarily want them to come into the clinic because they may expose others. And similarly, while they're in our clinic, they may get exposed to other pathogens that are going around, like a stomach bug or a respiratory bug. So they may bring it in or they may take it back. So it's always safer if we can just see them remotely. So a lot of carriers were covering it before, and now most of them are covering telehealth, with the current situation.
So let's talk about making a diagnosis from afar. Obviously, you can't check a person's temperature, you can't check their blood pressure, get their vitals like that. How do you actually work to get the diagnosis?
So, when I was a medical student, a great attending told me, he said, sir, William Osler used to say, listen to your patient. He's giving you the diagnosis. And what that really means is the most important aspect of our patient visit is that history, is what my patients tell me. When I hear it from their perspective, that is the most important part in me figuring out what's going on with their health. So the fact that I can talk to them and hear what's going on is crucial, but we can do somewhat of a physical exam too. Just actually talking to you right now, Chuck, I can tell that you're doing well, you're healthy, you look vibrant, you look happy, you look energetic.
Thank you.
Yeah, so you don't look like someone I need to worry about. On the other hand, if someone is really sick or ill, I can see that. I can pick that up in their tone, in their voice, in their energy level, and it can offer very valuable information. And then, other things you talked about, like checking their temperature or blood pressure. Obviously, we cannot do that ourselves, but now patients can check their temperature and tell me, and I've done that with several patients. They're ready. They're worried about COVID-19. They're sitting there. They're ready with their thermometer, and they check it right in front of me, and they say, this is what I have. Or even patients who have high blood pressure will have their cuff ready, and they'll measure it right in front of me, and then we'll go through the numbers and see what to do from there.
That's yeah, it strikes me like a lot how many people probably do have a blood pressure cuff at home. My wife and I actually have one, just because. Who knew? So, are you finding that a good number of your patients actually have this? I would assume everybody has a thermometer, but even things like the blood pressure cuff, you seeing a good number?
Yeah, so, well, actually, I find a lot of people don't have thermometers. So
You're kidding.
no, it's not surprising how often patients will say that, they don't have a thermometer and they kind of did the forehead test. So I encourage everyone, if they're worried about a fever or respiratory symptoms, especially now, to just invest in a simple drugstore thermometer so that they can have peace of mind about their temperature. And as far as blood pressure cuff, a lot of patients who do have high blood pressure have them, but some don't for various reasons. And then we talk to them about, options for measuring their blood pressure. But I would say you're right in that the majority of them do.
So, what if you talk to somebody and you need to see some blood work? How does that process work?
Yeah, so really no different than in the clinic. I can order blood tests for them to go to their local lab. In this area, we have various labs that are close to most people. And we just pick the lab that's convenient for the patient, and I'll order the labs. I'll tell them if they need to fast or not. And we will mail their orders to them or email them or snail mail them to them, and then they can just take the lab slip and go. And in fact, the labs are being great too because they're offering appointments, and they will allow patients to check in outside the facility, so from their car or just standing outside using their smartphone. And then they will send a message to them saying, we are ready for you to come in now, so that patients can minimize their exposure to the healthcare facility
Oh,
as
wow.
they're getting the
They,
labs done.
they don't have to wait in the waiting room. I didn't know that was going on. That's pretty smart.
Yeah, that's great because with COVID-19 or even with just other respiratory pathogens, a sneeze, a cough can expose others. So it's really important.
I would assume prescriptions work the same way. You just call it into their local pharmacy.
Yeah, exactly. So people either use mail order pharmacy, a lot of them are using that now just so they don't have to go to the drugstore, and we can do that, or we can order it to their neighborhood pharmacy, whatever is convenient for them or they feel comfortable with.
And how many patients have you spoken with in recent weeks that are concerned about having contracted the coronavirus? Have you seen quite a number of people?
Yeah, quite a few. And, the concern is real, the exposure is real. So people are concerned. They do call our clinic, they make appointments, and then just like you and I are speaking, I'll speak to them and discuss their symptoms and help them figure out the best step for them.
And it's around here for all of the COVID testing sites. I believe you do need a doctor's order to be tested, and that's something certainly that you can provide, correct?
Absolutely. So there are two types of testing sites right now, generally speaking. One is where any physician can order the test and patients can go to a drive-through site and get the test done. These are by appointments only. And then the other is people go directly to the ER and then they get evaluated there and they do it that way. Obviously, we'd like to keep people out of the ER, and it would be better if they can speak to us first so we can triage them and minimize their exposure.
Sure. And how long are your typical visits with the patient? Is it 15 minutes roughly?
Roughly 15 minutes for urgent things, like if someone has got a cough or a cold or a stomach bug they're worried about. But, we also do consultations, Chuck. So if someone, is not necessarily acutely sick, but they'd like to get better control of their diabetes or high blood pressure or just their cholesterol. So we do consultations, which can be longer. It really depends on what the patient needs.
I know now that we're accepting patients in a number of states, right? It's not just DC, Maryland, and Virginia anymore. Barnard Medical Center is able to reach a wide swath of people.
That's right. We can actually see patients from New York or California or Missouri or Massachusetts. So, we're trying to make our services available to people that are not in the immediate area because some people would like to consult with us without having to fly across the country. And especially now, they wouldn't want to fly.
And just in case somebody's wondering, should they schedule an appointment to visit with you? Maybe they're feeling a little bit under the weather and they're concerned that it is COVID-19. What are the symptoms that would kind of lead you to believe that, yeah, maybe they should go get tested?
So, a couple of things. Unfortunately, we don't have enough tests to test everybody who may be symptomatic. So, the recommendations from the CDC are to really test high risk persons. So, those are people who are either in need of hospitalization or healthcare workers. For someone who's having mild symptoms, they may actually not even need to be tested, and we can evaluate them and tell them to sort of self-quarantine at home, take care of themselves, and check in with us in a few days and see how they're doing. Someone who's having more severe symptoms, who I think would need to be in a hospital anyway, that is someone I would want tested because I'm thinking maybe they'll need more acute care shortly.
And if somebody unfortunately does need to go to the hospital, you mentioned that you can send an order to one of the testing facilities. Can you also give the hospital a heads up that the patient is coming, or how does that process work?
Yeah, so, Chuck, we do this in the clinic too. We see people, even before the pandemic, we would see people in the clinic that would come see us, say, for chest pain or respiratory distress, that we would need to send to the emergency room because we are concerned about something acute. And the way it works is we call the emergency room triage line. We either speak to a physician or nurse who is accepting those calls, and we explain the situation, why we're sending the patient, and then they are expecting to receive that patient within the hour. And then we arrange for a safe way for the patient to get there. Usually they can drive or maybe a family member can take them. So with telehealth, it would be no different. If I think someone is really sick, they need to be in the hospital, I would work with them and a local hospital to facilitate that.
Outstanding. Well, Dr. Vanita Rahman, I can't thank you enough for your time this afternoon. You have just really shed a whole lot of light on something that is completely new to so many of us. So I'm excited about this. I think that this actually could be the future of medicine.
I agree, Chuck. I think if there is a silver lining in all of this, it's that, the way we do certain things will change. In the future, we may use more telemedicine, just because more patients and more healthcare providers will now feel comfortable with it. And I think it will help us overall as a society.
All right, Dr. Vanita Rahman, thank you again. Look forward to seeing you back in the real studio, hopefully in the near future.
Definitely. Thank you, Chuck.
If you like that interview and you want more of it, go ahead and subscribe to this YouTube channel. Leave a nice comment below. And for the full interview, also head over to Apple Podcast and subscribe to the Exam Room Podcast by the Physicians Committee. New episodes with information and inspiration each and every Wednesday.